Hello, my name is Elisabeth and I'm an occupational therapy assistant student at Bryan and Stratton College in Wisconsin. Today I will be going over a home exercise program for individuals who experience arthritis in their hands. Specifically, I will be talking about the similarities and differences between rheumatoid arthritis and osteoarthritis. This video is designed to target the muscles and joints in the hands for individuals who experience discomfort due to rheumatoid arthritis or RA and osteoarthritis or OA, and should be performed with permission from a treating physician. Before we get started, it's important to note that these therapy exercises should never create deforming forces or cause pain in the client. Range of motion exercises are to be kept pain-free to prevent stretching of joint structures. For those individuals with osteoarthritis or OA who are performing strengthening exercises, I advise caution to avoid aggravation of deformities. For those individuals with rheumatoid arthritis or RA who are practicing a home exercise program, I advise that you do not use resistance at all. These exercises can be performed in a seated or standing position depending on what you are comfortable with, but safety in the environment is always a top priority. If you decide to practice standing up, please make sure you have the proper standing activity tolerance and balance to do so, or have someone nearby or an ambulation device to assist you. With that, let's get started. Here is a list of some materials that you may need for this video, including a washcloth or hand towel, a 1-inch wooden dowel or other cylindrical object in your home such as a fat highlighter, small flashlight, fat handle of kitchen utensil, or so on. You may also need a small cup less than halfway filled with water, a flat surface to rest your hand on, a chair to sit on if you decide to perform these exercises while sitting down, and a kitchen sink with warm water and cool water on separate sides. If your sink is not divided, feel free to fill up buckets or bowls of water. I will specifically go over how we use these materials later on in the video and what temperature they should be at. Before we get started, let's look at why we do these exercises and what the benefits are for people with rheumatoid arthritis and osteoarthritis. These exercises help maintain typical joint movement, increase muscle flexibility and strength in the hands, reduce pressure on the joints, keep bone and cartilage tissue strong and healthy, and help increase stability for functional activity. With both OA and RA, pain can be measured on a scale from 0 to 10, 0 being no pain at all, and 10 being the most severe pain. It's important to report pain that feels real to the individual with arthritis. Research shows that many arthritis patients tend to downgrade their pain instead of reporting accurate numbers. Please always let your therapist or physician know the pain you feel before and after activity honestly and accurately. Some other precautions before we get started include avoiding passive range of motion exercise and measurements, especially if there's a lack of joint stability. Do not apply passive stretch to an OA or RA joint that lacks stability because it can be injurious. Another general principle of exercise includes avoiding painful range of motion by working within the individual's comfort level. Also, stability must not be sacrificed for a possible increase in strength. Patients, remember to report pain levels to your therapist or be mindful and make sure you are getting the most out of these exercises without increasing joint pain. You are the only one who knows how you feel, and you should honor that. If at any time during this video you feel increase in discomfort, stop the exercises and report to your physician or treating therapist for possible modifications or adaptations. With that, let's get started. Research shows that massaging the web space between your first finger and your thumb can help prevent contractures and hyperextension deformities from occurring. To do this, find a comfortable seat with a sturdy surface to rest your arm. Place a washcloth or a towel under your hand with your thumb pointing up. Slowly rotate your thumb away from your hand so your grip looks like you're about to pick up a can of soup or other cylindrical object. When you're ready, start to tap the tip of your thumb to the base of your first finger. Once you've reached your thumb as far as it will go, bring it back to its original shape. Next, start to tap the tip of your thumb to the base of your middle finger. Again, once you've reached your thumb as far as it will go, bring it back to the original shape. Now, try to tap your thumb to the base of your ring finger. Again, bring it back. Finally, try to reach to the base of your pinky. Once you've completed the 4 fingers, work your way backwards, tapping the pinky finger again and moving up to the ring finger, middle finger, and first finger. That was 1 repetition. Try 5 of these or until your hands become warmed up. If you cannot reach all the way to the base of your finger, try to reach as far as you can without creating pain or discomfort. If this is painful, stop the exercise. By completing this exercise, you are not only warming up the web space between the thumb and first finger, but also helping to provide stability to the base of your thumb joint. This next exercise will continue to warm up the web space, while also integrating finger flexion in the hand. Begin with your hand flat on a sturdy surface with a washcloth or towel underneath. Again, rest your hand with the pinky side down on the washcloth. You will need your 1-inch dowel or other household cylindrical item at this time. Place your cylindrical item in your palm and wrap your thumb around the top to create stability. Without gripping onto your dowel too much, start to slowly curl your fingers around the 1-inch diameter. Try to keep your fingers straight and focus on only curling your first knuckles around the dowel at this time. We call these L curls. Complete 10 of these L curls on your arthritic hand, remembering to be mindful of pain and discomfort. Our next exercise will work a little further into finger flexion down into the fingertips. Start with your hand flat on a sturdy surface with a washcloth or towel underneath. Place your hand with the pinky side resting on the washcloth or towel. Just like the L curls, start to bend your first knuckle slowly, letting your fingers wrap in towards your palm. Once you've reached about halfway, start to curl in your next set of joints. Your hand should look like the position it would carry grocery bags with. We call this a hook grip. Slowly start to flex your last joints of the fingers, creating a soft knuckle. Again, the focus is not to squeeze, but to target range of motion along the length of the fingers. Once you've reached a fist, slowly release back open to your starting hand position with all fingers extended straight. That was 1 repetition. Try 10 of these finger bends on your arthritic hand, remembering to be mindful of pain and discomfort. Now that we've worked on all the finger flexors, which are on the palmar side of the hand, it's time to work on the extensors on the back side of the hand. Begin with your hand flat on a sturdy surface. Just like the last 3 exercises, slide a towel or washcloth underneath your hand. This time, keep your hand flat on the towel or washcloth and spread your fingers apart. Starting with the thumb, begin to lift this digit off the towel while keeping the other 4 fingers stable. You do not want your palm lifting off the towel, only your finger. Gently place your thumb back down and try to lift just your first finger, again leaving the other digits stable against the table. Only your finger is lifting again. Gently place the first finger back down and try with the remaining 3 digits. If you really want to challenge yourself, try repeating these finger lifts in the opposite direction, pinky to thumb rather than thumb to pinky, for your next repetition. Lifting each finger once counts as a repetition. Do 10 of these finger lifts on each finger, always keeping control and stability in mind. This next exercise is intended for individuals with osteoarthritis or OA. Because there is resistance, I advise that individuals with rheumatoid arthritis or RA do not perform these exercises. You will need your small cup of water filled halfway for the strengthening and stability exercise. Know that you can always pour out water if half full seems like too much or creates pain in the joints. Begin with your hand flat on the table with your washcloth or towel underneath you. Create the letter L with your first finger and thumb lying flat. Place the cup of water in front of your first finger and begin to push it towards your thumb. Once you push the cup as far as it will go, reset your finger back to the starting L position. With your other hand, reposition the cup to the inside of your first finger to start again. That was one repetition. Strengthening the muscles on the side of your index finger may help stabilize the base of your thumb. Pushing a glass sideways with your index finger with your hand stabilized is a nice way to activate this muscle. Try 10 of these finger pushes on your own, being mindful of any fatigue or pain that creates discomfort. This last exercise will focus on the wrists more than the fingers. It's important to stretch out your wrists for good stability and mobility in the rest of the hand. To begin, start sitting up nice and tall and bring your palms together to touch. You can either interlace your fingers or keep your fingers long in a prayer position. Choose whichever option is most comfortable for you. When you are ready, slowly start to guide your fingers or knuckles over to the left-hand side. This creates length in your left wrist. Once you've reached as far as you can go with comfort, bring your hands back to center where you started. When you are ready, slowly start to guide your fingers or knuckles over to the right-hand side now. This is creating length in your right wrist this time. Once you've reached as far as you can with comfort, bring your hands back to center where you started. Try 10 of these, back and forth, to create mobility in the wrists. Moist heat and ice compresses have both been shown in studies to reduce the stiffness, inflammation, and pain associated with arthritis. Contrast baths simply combine the two therapies. All you'll need are 2 basins. This could be a 2-tub sink or 2 bowls filled with water. If you wear jewelry, you will want to remove any rings, bracelets, or watches before soaking. Start by filling 1 basin with very warm water, about as warm as you can tolerate comfortably. I use hot tap water. If you are an individual with decreased temperature sensation or numbness in the hands, don't use contrast baths without medical supervision. You risk scalding or burning if you can't feel the temperature of the water. Fill the other basin with cold water. I use cold tap water and then add about 6 ice cubes. Place the basins side by side if you're using bowls. Place your hand or hands in the warm water first. Soak for about 3 to 4 minutes. This is also a great opportunity to practice your range of motion exercises. The heat will help moisturize and warm up the muscles in the hands to create a little more active range of motion. Switch your hand to the cold water and soak for 1 minute. Warm water opens up capillaries and increases blood flow. Cold water does the opposite. The theory behind contrast baths is that the back and forth of heat and cold creates a pumping action that decreases swelling and inflammation around the arthritic joints. If you have them available, you can also add a few drops of your favorite essential oils. Repeat these steps 4 times, ending with warm water soak. Let's review contrast baths. Again, do not use or attempt contrast baths without medical supervision if you have decreased sensation or numbness in your hands. This can be very dangerous. Start with warm water first for about 3 to 4 minutes. You are more than welcome to try the exercises provided in this video or other ones provided by your therapist in the warm water. After about 3 to 4 minutes, switch over to cold water for 1 minute. Repeat these steps 4 times, ending with a warm water soak. I hope these exercises have been beneficial for you or someone you know who lives with osteoarthritis or rheumatoid arthritis. If you have any questions or concerns, please drop a comment below. Remember to always listen and follow protocol from your therapist or physician first, and keep in mind your personal comfort level. Therapists, we would appreciate your feedback regarding implementation of this video. Please take a few minutes to complete the brief survey using the provided link below. I hope you found the information in this video helpful and learned something new. Thank you again, and until next time.